Welcome to One Health Wednesdays, where all health connects. I'm Dr. Ginger Dixon from One Life Epi Solutions, where we're dedicated to breaking down the silos between health disciplines to address our world's most pressing challenges. Whether you're in public health, medicine, veterinary science, wildlife management, or environmental conservation, this podcast brings you insights that bridge our collective fields. Each week, we bring you conversations with thought leaders and innovators who are applying One Health principles to create sustainable solutions across the globe. Welcome, and I'm excited today to have a repeat guest. We have Dr. Chanchal Bhattacharya. He is a 30-plus year veteran public health veterinarian. He works in India, in Delhi, and is actually one of those people that have been doing One Health since before we really started calling it One Health. So I'm very excited to have his expertise on today and share more about, his work and what he's been doing. Dr. Bhattacharya was sharing with me some of his work in working on One Health in USAID in India, his work in AMR and antimicrobial resistance, including working on things, zoonotic diseases such as rabies and other livestock illness, such as African swine fever and avian bird flu. So I am truly excited to have you on today and get to chat with you again.
Thank you. Thank you very much.
Yeah, and I'm going to take a brief pause here for a message from our sponsors, and then we'll get started.
Concerned about the future of public health and our planet? One Life Epi Solutions has the answers. Introducing the One Health Playbook, your free guide to integrating One Health into your organization. Inside, discover actionable strategies, data-driven insights, and frameworks for powerful cross-sector collaboration. Learn how to streamline data collection, create impactful educational materials, and make a real difference. Download your free copy of the One Health Playbook today and start building a healthier tomorrow. Visit tinyurl.com/OHORG Playbook. That's tinyurl.com/OHORG Playbook.
And thank you, Dr. Bhattacharya. Feel free if I would love for you. I know it's been a few years. If you want to share just an update on your background and what you've been up to.
Sure. Absolutely. You can ask me question regarding Avian, whatever is in your mind. I will try my level best to give you answers.
Thank you. I always enjoy talking with you because you have this very, with all of the wealth of knowledge that you bring, you always have this very just calm, matter-of-fact type of approach to questions. So thank you for that. But definitely, and you were sharing with me before we got started today that you had just received, not just, it's been a few years now, but you had received a Lifetime Achievement Award in 2023. And I just wanted to congratulate you publicly on that. Do you want to share a little bit more about the award and just what you've been working on?
Yeah, basically, actually, the award is conferred to me because of my whole life work, because I work in the aspect of veterinary public health, basically in India. And in veterinary public health, there are a lot of aspects. I usually work for control and containment of avian influenza, then rabies, then glanders, then different aspects of antimicrobial resistance like this, you see. For a very, very long time, I was responsible for zoonotic and infectious disease control in the capital of India. I was the state zoonotic disease officer in integrated disease surveillance project of Ministry of Health and Family Welfare. Then I was inducted to the National Rapid Control Program in India as a domain expert from animal health side. Then there are other committees of diseases related with climate change, you see, in our country. The Ministry of Health and Family Welfare inducted me. So the Ministry of Health and Family Welfare analyzed my work for a long time. And my institute, from where I obtained my Master of Veterinary Public Health, it is all in of Hygiene and Public Health in under the University of Calcutta. they have decided to confer me the Lifetime Achievement Award in 2023. So I'm really grateful to them that they had that much of confidence on my work. So they have analyzed my work for a long time, and uh, they uh, they were satisfied with my work, and after that, they decided to confer me this award. You see.
Yeah. Well, congratulations. And I think it is well deserved. Absolutely. When we were catching up, you were sharing about how you were working on avian bird flu back when it was still at the low pathogenicity and creating these protocols and processes that were really around One Health. Before we had these kind of fleshed out frameworks and before the avian flu, um, you know, mutated into this high pathogenicity form. And so, um, I think that you definitely have a long spectrum of work and experience to share.
Yeah, yeah. Yeah. Actually, I would like to share some personal experience here. You see, in 2006, the first bird flu outbreak took place in India. Okay. Before that, we did not have much idea about the bird flu, what exactly the bird flu is, and what is the danger, what is the risk can be arised from bird flu. So you see, in 2006, when the first bird flu outbreak was taken place in Maharashtra, India, then we have been asked to prepare SOP, standard operating procedure for Delhi state. But we did not have much material at that time. Even in the materials are not available about bird flu, but with great difficulties, we obtained some materials from CDC, uh, uh, other organizations, FAO. So we prepared a tentative SOP for Delhi state. After that, the notification from our ministry, and gradually we started gathering a lot of information regarding bird flu. And starting from 2006, almost in India, we have observed that bird flu outbreak takes place in India, and it is basically related with the migratory birds. You see, in India, most migratory birds are coming from Russia, Siberia, and Mongolia. So they have been traveling from Scandinavian countries also sometimes. In fact, and mostly when the birds arrive in India during November, December, after that, the bird flu takes place because these migratory birds bring the virus here. And mostly they are based in water bodies in different cities, different villages, you see. And in all the water bodies, you will find out local birds or ducks. Then the pathogen transmission takes place. When the migratory birds are mixing with local ducks or local, like different indigenous birds are here. They are wild birds. They are not domesticated. So they getting the pathogen, the bird flu pathogen from wildlife of these migratory birds, and they started spreading it in the environment, and ultimately the poultry farmers are suffering because of the outbreak of bird flu in their poultry farms. You see, actually, our government has decided to cull the birds. If there is any outbreak in a particular poultry farm, or what we do, we make a notification from the government, and we make the quarantine system in and around this farm, and we started culling. And in this process, this is a very lengthy and complicated process. Initially, when we started working in, we did not have much knowledge about it, how to expedite all these things, how to cull the birds, how to make the pit where the birds should be properly buried. But after that, we got assistance from international organizations like FAO and World Organization of Animal Health. At that time, it was OIE. So we got guidance, and we started working with experts. And ultimately, you see, we got ourselves prepared. So each and every year we are facing this problem. So right now we are very, very advanced with technological supports and our own knowledge of bird flu. Now we know how to combat, how to prepare ourselves, how to the rapid response team in different areas. These are the things happening in our country. You see, gradually we are gaining more and more.
Absolutely, absolutely. And it sounds like, if the bird flu is spreading based on these migratory bird patterns, that there's a lot of seasonality to it, that there's a certain season that you see, these bird flu outbreaks kind of popping up that are being brought in. But now that it's become more widespread, are you seeing more regular transmission throughout the year, or do you think it's still kind of a certain time of year that's been more high risk in your area?
Yeah, actually, you see, what we did, we have identified some particular zones where every year almost we are finding out bird flu during winter season or after winter season. So we are mapping it. Okay, we are mapping the geographical areas where each and every year we are getting these infections. And you see, we have an institute called Nivedi. They are usually working with veterinary epidemiology and data science. So what they are doing, they are analyzing the data from the field where bird flu outbreak already took place, and they are analyzing it according to the climatological data and the outbreak based on outbreak investigation. Okay. So after that, we are having some prediction system, and we can predict right now that where exactly the infection can be happened, or what type of precautions we must take, because we are having guidelines of Ministry of Animal Husbandry, Fisheries and Dairying, where considering the real situation on the ground, we are issuing these guidelines to all state governments how to combat with the situation. If the bird flu outbreak will be there in a particular area, so how the state government will act. In our country, animal husbandry is a state subject. Definitely the federal government, the central government will issue the guidelines, but the implementation part lies with state government. So right now, you see, every year we are getting ourselves prepared, and we are having our contingency plan and disaster management plan, so that if anything will be happened, we are ready to combat with it. Okay.
Yeah, that's fantastic. And sorry, not to cut you off, but I'm so excited to hear that, because that's one of the things that we do in supporting organizations. We come in and we do this like data analysis and setting up these systems, and that is fantastic that you guys have such a robust, system and process in place, that you have both this surveillance and the data analysis. And then you have guidelines, that are evidence-based based on what's going on in the field. That's perfect. So very excited to hear that, especially I'm an epi, I'm a data person. So you start talking data and I was like, yes.
Here, Ginger, I would like to inform you one thing, that you see, intersectoral coordination plays a very major role to control the danger, because you see, the control and containment of a particular zone, when it will be imposed, then not only the animal husbandry or veterinary department is involved, but also the health department, the public works department, this police authority, all of them are involved. Okay. And a very close intersectoral coordination is required at the time. So whenever the order is notification of what is out, then as an example, if it is happened in a district, then the district magistrate or district himself or herself will be responsible for carrying out all these activities, because he or she will be the supreme commander of the district for all departments. All departments are coming under him or her. So what I have seen in Delhi, that when flu outbreak was there, all the departments are having their own responsibilities. They are doing uh, their particular work. Otherwise, you cannot it, because if you are expecting that only animal husbandry or veterinary department will act and they will do all the things, it is not possible. So this is called One Health, and this is a collaborative approach. You see, where every department is playing their own role, and in case of implement part, every department has their own responsibility so that they can clearly implement the plan in ground level. That is very important in my opinion.
Absolutely. I mean, it sounds like that communication and kind of the joint operation side is just as important, in that type of working together. And as you said, especially capacity wise, I don't know that, here in the United States that any one agency would have the capacity to just come in and do it all themselves, and that is important to get kind of everyone on board and then to get all the expertise on board in that decision making process and intervention. Um,
Yeah, this is actually, you see, in case of bird flu outbreak, our health personnel are playing very significant role because you see, the high risk personnel like veterinarians, paraveterinarians, or poultry owners, poultry workers, they are prone to bird flu uh, virus. So the health department must carry out surveillance and investigations. They collect the blood sample. They must screen the people who are closely in contact with poultry farm or in culling operation. They can identify whether the person is suffering with any clinical symptom or not. If the person is suffering with any clinical symptom, immediately he should be put in quarantine. He should be put in isolation. And if the blood sample is positive, then the proper treatment should be undertaken. Usually, we are using oseltamivir here in India, and antiviral drug.
mhm.
These are the things where medical doctors are also playing very, very significant role. They have to create a quarantine process. They have to create isolation wards, and some hospitals, big hospitals with laboratory facility, these hospitals are earmarked for undergoing bird flu treatment because you need isolation ward. In small hospital, it may not be available. So the hospitals are well equipped, maybe in district level. So they are assigned to look after the patients who are closely in contact with poultry birds or farms or affected environment. Okay.
Yeah, absolutely. Absolutely. I mean, and especially as you said, having that capacity for containment and proper isolation is definitely important. If I remember correctly, the bird flu it's a droplet transmission, right? So it's like a similar transmission type as COVID.
Yeah. Yeah. Actually, right now, if you are analyzing the epidemiological situation of bird flu, there you will find out that there is a rapid change. Since 2023, there is a rapid change in bird flu epidemiology. Number one thing is species jumping.
Mhm.
Earlier, we did not notice, but in 2000, since 2023-24, we have got a lot of information from USA dairy industry that the dairy cows are affected with bird flu virus. Earlier, we did not have this type of evidence or findings. But this is a major matter of concern, you see, because uh, we are expecting maybe the next pandemic with maybe it is lying with bird flu. You see, we are expecting, and some mathematical modeling are there also. They are also predicting, but it is really a huge matter of concern because earlier only birds are affected. Right now, the dairy cows are affected, and species jumping takes place. In our country this year also, in the February, we have a state called Madhya Pradesh. There are incidences of cats. When cats died due to bird flu virus H5N1, the cats have uh, sneezing, then debility, then high off feed. They are off feed, and after that they are died. And when we collected the sample, we identified that it is a N1 virus. In last year, in Maharashtra state, there is a zoo garden. There is a big zoo called Nagpur. The city is called Nagpur. In Nagpur city, 3 tigers and 1 leopard died in bird flu. That is a very, very dangerous incident. When the process of identification of virus was established, so we came to know that maybe it is through the zoo workers who are working with the big cats, you see, and the poultry meat maybe, which are provided to the big cats for their feeding purpose. So you see, transmission of virus, it is a very complicated thing. So we must strengthen our biosecurity. This is the major thing in bird flu control. Biosecurity should be optimum in every respect.
Yeah, absolutely. Absolutely. And what types of biosecurity measures are you recommending? Especially with now, as you said, having that kind of higher risk and being even more on our radar with the species jumping from dairy cows and cats and other mammals as well.
Yeah. Here, I would like to inform you that in all poultry industries, big poultry industries, strict biosecurity measure maintained. As an example, if it is a broiler farm, then all-in, all-out process is followed. What is all-in, all-out? The broiler birds are brought together, they are reared, and they are sold. After that, there is a gap for 10 days or 50. There will be no birds. At that time, fumigation, cleaning, this type of things will be happened in the farm, so that no pathogen from the earlier stock can remain in the farm. Then when the specialists sure that there is no bird flu pathogen, only then they are going to introduce a new batch of poultry. This is called all in, all out. Simultaneous, the poultry premises where the farm is located, it should be absolutely under strict control measure. Nobody should be entering into the farm except the farm workers.
Mhm.
And the farm workers should not be allowed to go to the other farms. Okay. So when they are entering, they will take a bath. They are taking a disinfectant bath, and they must change their garments and shoes,
Mhm.
because it is an established truth. The garments and shoes can bring pathogen from outside to the poultry farm. So we must take this type of strong measures or strong biosecurity measures.
Yeah.
When the vehicles are coming, okay, with feed or with other ingredients, then the vehicle, with the wheel of the vehicle should be properly disinfected. There should be a foot bath before the entry point, before the entry gate, and the vehicle should pass through the this foot bath system where disinfectants are there, and the wheels of the vehicle are properly cleaned and disinfected. So another one thing is that actually there should be a um, uh, proper mechanism to protect the poultry farm from scavenger dogs or
Mhm.
migratory birds also. You see, actually,
Yeah.
usually right now the big poultry farms are operating in a very sophisticated manner, and they are having all sort of technological support, so that they are having electrical fencing also and big wall in and around the poultry farm, so no scavenger dogs can enter. Simultaneously, when the migratory birds are there are mechanisms, there are electrical impulses through which the migratory birds can be prevented to enter into the poultry shed. Okay, so your quality assurance system should be in a high level. When you are getting a feed, your feed analysis lab should be up to the. You must analyze your feed, whether the feed is proper or whether the feed is infected. If the feed is infected, then immediately it should be. So there are a lot of things. You see, there are a lot of things, and if you are suspecting some birds who are a bit disease prone, then immediately they should be isolated. They should be quarantined, and even if the bird flu identified in a one shade or in one particular enclosure, then the person who is working in this enclosure, he will out to go to the other enclosure or other shade. So there are a lot of things. Day by day, we are imposing this biosecurity in our poultry business. Because in our country, you see, biosecurity is the only measure through which we can protect our poultry. Because vaccination is not allowed in our country, and we are not giving any vaccination here in India. Though for human vaccine, Indian Council of Medical Research has undertaken some project for developing messenger RNA human. But in case of poultry birds, we are not allowing vaccination. Okay.
Yeah, what are some of the challenges around, the mass vaccination for animals in this case? Because I know, I sometimes it sounds like, oh yes, we have a vaccine, or we have a potential for a vaccine. Let's use that. But there's also a lot of decision points, that come in there about the type of virus or feasibility and cost and safety for the vaccines. And so I'm curious about, behind the scenes what that vaccine discussion
Yeah,
like for animals.
I understand. Actually, sometimes we are doing low pathogenic avian influenza vaccination in case of layer birds. But in case of broiler birds, if it is a highly pathogenic avian influenza, we are not doing it because it is a matter. Because our central government is analyzing the situation, and maybe in future they will decide whether the vaccination will be prudent or not, for our country. But right now, you see, the central government has not yet decided whether they will go for a vaccination or not, because we are doing a lot of data analysis right now. Because from other countries where the vaccination takes place, we have identified that, as an example, if you are doing vaccination to the birds, sometimes the birds are shedding this virus itself. You see, after that, they are becoming carriers. There are other complications also. There are other complications because this is a policy matters. I can't highlight much because this is absolutely the decision of our government. So maybe in future we'll see some new things in case of vaccination, because a lot of research is going on right now.
Yeah, absolutely. And that is a decision that, you definitely want to root in the data and in the evidence, and, and understand, like you talked about, that viral shedding potential, and then just cost is, massively difficult to produce vaccine, especially for the number of livestock that would have to receive it, or especially vaccine programs in the wildlife, or things like that. And there's always big challenges. So definitely it's a lot to take into account. I can definitely understand that. Thank you.
Yeah. Actually, you see, in case of wild birds who are migratory birds, vaccination is not possible because they are not under your. Sometimes they are going in one country, sometimes they are going into the other country. So you see, geographically they are not based in a particular place. Impossible to vaccinate them. Um, to identify their pathway, what some countries, some Scandinavian countries, what they did, they implanted some microchip in the birds. Okay, in a particular flock of birds, when they are traveling for 10,000 kilometers or 50,000 kilometers, through this microchipping, they can identify the pathway. So right now, we have a clear-cut idea what exactly the pathway of the birds and how they are traveling from one country to another country. So it is also helping us from epidemiological point of view. It is also helping us to identify that where the birds will land, and so that we can prepare ourselves, can anticipate that these things can be happened, and what will be our contingency plan, or what will be our disaster management plan. So accordingly, we can chalk out the plan. We can prepare ourselves. That is very important also.
That is, and that's very wise. Looking at those pathways and again, just taking this evidence-based approach to, preparedness and intervention. And I think that's wonderful. And especially, I'm sure that took a lot with this like international collaboration as well.
Yeah.
As you said,
Yeah.
nobody quite owns these migratory birds. So taking
You
that.
you see, there are two types of collaboration. There are two types of collaborations in Avian. One is the in-country collaboration. In case of in-country collaboration, you see here Ministry of Health and Family, Ministry of Environment and Forest and Climate Change, and Ministry of Animal Husbandry, Fisheries and Dairying. They are having a consortium, you see, in our country. They are closely monitoring the situation every year before the bird flu outbreak. They are conducting the meeting under the chairmanship of our highest body in our country, and they are taking the measure how if the bird flu outbreak will be there, then what will be the responsibility of each ministry. Like the major ministry definitely here, this animal husbandry ministry, because they are directly involved with poultry birds and poultry rearing and poultry industry. So they are preparing their SOP, and simultaneously the health ministry is having a lot of responsibilities. If the people be affected, then how they will tackle the situation. They have to have a sufficient quantity of medicines or isolation ward like this, you see. And in case of environment and forest ministry, they are having a lot of challenges, because in wild there is a threat of bird flu transmission, because this is a RNA virus, and you know that the RNA virus is tendency of mutation. So we are seeing that the virus can be changed in the environment. So we have to be very cautious about it in case of wildlife also, because already we have got intimation that the big cats are prone to the infections, and they are dying. And if the virus can be transmitted to the free-ranging tigers, or leopards, then it will be a very big problem for us. It will be a very big problem. We do not know how to tackle this problem. So we have to be very vigilant, and we have to be very careful about it.
Absolutely, absolutely. And that I could see that very quickly becoming a conservation, an ecosystem stability issue as well. Those big cats are usually a huge part of the stability of ecosystems. And then we talk about, the all of that good stuff that we also, are looking at in One Health about biodiversity and ecosystem stability, and the effect that the avian influenza can have in wildlife as well. And that is challenging. I imagine it's much more difficult to microchip and follow big cats as well.
One thing I would like to add here, you see, avian influenza is such a disease which has a lot of social and psychological impacts. Social, psychological, and economic impacts. As an India is one of the highest poultry producers in we are what us in the world. So thing is like that when there is an outbreak of avian influenza, the trade is suffering, internal trade and external trade. Okay, the trade there are a lot of misinformations. So here I believe that the press, both the electronic press and printing media, they should play a significant role to make people aware that in case of bird flu outbreak, there is no ban on consuming poultry meat or egg. You see, because the virus is vulnerable and is breaking at 72 degrees centigrade. So, what is the cooking pattern of Indians? This is very safe. But sometimes you see people are getting scared. People are getting reports from print media or electronic media via television. So, the press should play a very matured role here in this bird flu aspect. You see, there are economic also in case of bird flu. As an example, the people who are directly involved in poultry farming, they are losing heavily at that time because the sale of birds are getting down and they are not getting the proper price. So the farmers who are directly involved with the poultry production are heavily suffering. So definitely, if there is a culling or other things, our government has a contingency plan. Our government has a plan to compensate them. But when the market is down, you see, you are facing a lot of problems. The psychological problem is like, for example, I'm a poultry farmer. I have 10,000 birds and there is a bird flu outbreak. I am not able to sell this bird, but to make them alive, I have to invest heavily on the animal feed, on the poultry feed. So there is a huge psychological impact. Okay, I'm feeling insecure, right? So it's a very complex situation. In case of international trade, you see, in case of international trade, if you have bird flu outbreak in your country, then you cannot sell your poultry products outside your country. International trade, according to WTO, you see, World Trade Organization, we are a signatory of WTO. We have to comply the rules and regulations of WTO. We are facing a lot of international trade at that time are suffering heavily suffering. So it's a very complex situation. You see, our national economy is suffering. If bird flu outbreak is there, then not only I'm talking about the whole world. The economy also heavily suffering. So there are a lot of implications. We must consider about it.
Yeah, absolutely. Absolutely. And I'm sure, that's not, it's harder for, some of these small poultry farmers that, the biosecurity measures that you talked about, I know are not inexpensive, and definitely have a larger cost associated. And so, I'm sure that affects, those smaller poultry farmers differently. And like you said, weighs heavily on the cost of the feed and the economic return, and then that fear that, if their birds do get sick and they have to, cull them, the implications of that. And so definitely, I think you're very right to be focusing on this issue, and I'm thankful that you are still focusing on this issue, and bringing that awareness and continuing that stringent surveillance and action, and nationally as well. I'm very thankful to see the strong One Health framework that India has in place. And definitely thank you
Yes.
for sharing all of that.
Agreed.
Yeah.
So, in my opinion, that avian influenza or bird flu is a very complex problem. Okay, so when we are trying to solve it, there should be a sustainable approach. You see, a sustainable approach, and right now the climate is also playing a very significant role in case of poultry industry, though. So the disease ecology of the bird flu is changing rapidly. So we must consider all these things also, because there is a change in our environment. There is a high rise of temperature. As an example, here in Delhi right now, it is 30, 38, 39 degrees centigrade in daytime. In early morning or in evening, it is quite okay. It is quite comfortable. But right now, the temperature is gaining, you see. But if earlier also, if we are considering before 15 years of the bird flu epidemic, at the time, usually we found out that it ends in the month of March. But now, when the temperature is more than 40 or 44, 42 or 40, you will find out bird flu is going on. It means that adaptability of the virus is also changing according to the climate change. Okay, so things are getting complicated. Things are getting complex and complicated. So we have to prepare ourselves accordingly.
Yeah, definitely, definitely. And that is, I think for surveillance in general for these zoonotic diseases like bird flu and any that have this especially kind of a seasonal type of pattern that's based on animal behavior or insect behavior. We'll definitely continue to see those changes because of a changing climate. And so again, all the more reason to have these strong surveillance systems in place, and really tracking that migration and how that changes over time. Yeah,
Yes, sir. I appreciate the efforts of the governments and international organizations. See, in case of international organization, I must tell you that Food and Agriculture Organization, United Nations, and World Organization of Animal Health, they are playing a very, very huge role for bird flu control in throughout the world. Every year, they are preparing some new data and they are focusing on that and they are circulating it throughout the world, and it is accessible. It is accessible. If you have a laptop and if you have their website, you can easily download these things and you can make yourself up to date about the latest development of bird flu control and what is to be done, what is not to be done. So I believe that these international organizations are really having huge credentials in this regard for bird flu control. Recently, I have attended webinar of FAOs. FAO conducted two webinar, and throughout the world, people joined, and I gained a lot of knowledge. You see, I gained a lot of new things what we did not think earlier, but right now we started thinking about it. That these things can be also implemented on bird flu control plan. So we are enriching ourselves day by day. But the infection is also very smart. It is also getting more and more complicated. So
Right.
that we are facing a constant challenge.
yeah, that's true. I think, as you said, taking those opportunities to learn as much as we can and stay ahead of the stay ahead of the virus, I think is definitely
Absolutely.
yeah. Well, and I want to take this time and thank you for joining us and sharing your insight. Are there any like closing thoughts or ideas that you want to leave us with before we sign off for today?
In nutshell, that I believe that those who will listen my interview today, they will have an elaborate idea about the current situation of the disease and what is the importance of the disease, not only clinically but also sociologically, physically, from international trade system like this. You see, I tried to highlight in every aspect regarding biosecurity also. So I believe the people who will listen me, they will get a lot of awareness and a lot of knowledge. Thank you.
Absolutely. Thank you. Thank you again for your time and expertise. And as you said, for sharing that awareness and those um it's helping us understand more about why this is such an important issue and then what people can do about it. As you said, that psychological components, a lot of times people can feel very helpless, but we're not helpless. We have good knowledge and we have good technology and good communities, and frameworks in place for these things. So very grateful for that and grateful to see that you're still a part of that for 30 years and counting. So I thank you again for joining us today, and we look forward to getting to see you on this journey and continuing to serve. If your organization is looking to implement One Health approaches or needs epidemiological expertise, One Life Epi Solutions offers customized consultations to meet your specific needs. Visit our website to learn more at www.onelifeepisolutions.com. And don't forget to join our growing community by following One Health Wednesdays and One Life Epi Solutions on LinkedIn and subscribing to the podcast on Spotify and Apple. Please share this episode if you found it valuable, and together we can spread the One Health message.